Holly Warner here, owner, founder of Holly Warner Health. I am an expert in hormones, hormone replacement, thyroid for women and men, as well as autoimmune conditions, including autoimmune thyroiditis, but not limited to colitis, Crohn's, gastrointestinal, diagnostic panels. We do it all. We also do LDN therapy and cannabinoid therapy. So we kind of a one-stop shop when it comes to all of the things going on within you. I want to talk to you guys today about growth hormone. Some of you might go, oh, I'm a woman. That's not for me. Hold up. Wait a minute. Yes, it is. Now, the problem with growth hormone is that, number one, it is a very much controlled substance. So you have to have trained clinicians on board on your team who know how to properly assess the labs as well as how to properly prescribe. It is no joke. You do not want to have liver failure. You do not want your organs shutting down. You do not want the complications that come with growth hormone if you're not being properly monitored. It's not just for the big muscle-bound guys in the gym. It's for everyone who wants to have youth and vitality. It's kind of like sipping from the fountain of youth if you do it right. Unfortunately, the monitoring needs to be done very heavily. So we're talking every 3 months without exception. And you're looking at spending between $400 and $600 a month on your growth hormone. Now, some of you who are in the States might be watching this and going, oh, I can just get this stuff online, whatever. Cool, awesome. Where are you getting it from? Is it coming synthetic from China? Is it something that you know has been FDA approved? What's the source? Is it clean? Are you brown bagging it off some guy off the internet? Are you monitoring? Because you're going to want to monitor when you're on this stuff. There are markers that you need to look at just in case something goes wrong. Because, things can go wrong. However, we do this in my clinical practice and we monitor very heavily. It is something that I absolutely love when someone is a candidate. But not everyone is a candidate. Not everyone's wallet can support the use of this. Physician fees, practitioner fees, prescription fees. It's a lot of fees. So I wanted to have another option. And now I do. Introducing a gel. Now, for years, I have spoken out against anything that's homeopathic. The gels don't work. They're BS, blah, blah, blah. This has been my philosophy for a number of years up until now. I have watched the journey of colleagues, physicians, MDs, cardiologists, chiropractors, traditional Chinese medicine. I have watched these colleagues use this gel in clinical practice as well as on themselves with fantastic results. This made me say, perhaps this is worth looking into. It is a homeopathic gel. It has herbs and glandulars in it. It is growth hormone. It is fantastic. Lots of things are FDA approved. Remember Coumadin? High? That's in freaking rat poison, people. It's used to poison rats so that they bleed out and die. That's FDA approved. I'm gonna pass on that one. How about statins that don't freaking work? Except for maybe that 2% of the population that they do work for. They don't work, they do more harm than good. FDA approved. Birth control, okay, that works. But the side effects are absolutely ridiculous. FDA approved. There's a lot of crap out there that's FDA approved that I wouldn't give to my enemy. FDA approved versus FDA registered to me is, some people are like, oh, it's only FDA registered. As I said, there's a lot of things out there that are FDA approved and I wouldn't touch them with a 10-foot pole. Side effects. Listen, the side effects with this gel are pretty simple. If you use too much, you're gonna know it. That's why we microdose and we do loading. So we start you with a pea size and we bring you up to like a blueberry. You may never get to be a blueberry. Maybe you'll always be a pea multiple times per day. I'm not gonna get into the dosing, but I will help you when the time comes. Here is the interesting part. If your blood pressure is high, it's gonna help to balance it out, which means if your blood pressure was already low, you wanna pay attention, which is why it's great to be monitored. be aware of your pre-existing conditions, which is another reason why you can chat with me before you buy the gel. I have no problem with that. If you're someone who is on thyroid medication, it's going to help your body regulate your thyroid naturally, so you may need to lower your dose. Again, if you're on thyroid medication, you're either seeing a physician, whether it's functional medicine or an endocrinologist, who is prescribing your thyroid medication. They are also then monitoring your thyroid, so they're gonna see, oh, look, you need less medication, and they'll titrate accordingly. Pretty easy, folks. Those are the side effects. It is not like injecting growth hormone. You're not at risk of having some sort of massive reaction that you can't reverse. You're not at risk of liver failure. You're not putting yourself at risk of anything detrimental. This is more homeopathic on the growth hormone side, and it does have the herbal support and the glandulars. Your body's going to regulate on its own and do what it's supposed to do. You don't have to worry about being jammed with a massive amount of something that your body doesn't know what to do with. That's the difference, and that's the beauty of this product. So what's this stuff do? Improved sleep is the first thing that I'm seeing from people who are using it. A feeling of overall wellness, mental cognition and improvement, mood. People are seeing a boost in testosterone. We see this because they're being prescribed less testosterone by using this gel. Your afternoon energy dip, gonzo. People are seeing an afternoon energy boost. Who doesn't want a 3 p.m. kick in the pants? Thyroid, we're seeing an improvement in thyroid markers. Now, with this gel, it is a cumulative response. It is a cumulative benefit. That means that if you're gonna start it, and I would really like to see more and more people trialing this, if you're gonna start it, you're gonna need 4 months to see the full results in most cases. Some people are seeing results in a week. Some people are seeing, because it's cumulative, it's compounded, they're seeing some results in a week, a lot more results in 4 to 6 weeks, and by the time they reach 12 weeks, they're going, oh my gosh, this is amazing. I've seen some patients that have said, I didn't really notice a whole lot. It wasn't really that big a deal. They stopped it, and then gradually things started to surface, and they went, oh, I really did feel better. It's reset their new normal. Their new normal is not a normal that's subpar. Their new normal is now actually a fully functioning, happy, healthy normal, which is where our normal is supposed to be, but because we're so used to functioning in a sickly state that our normal is subpar. Women are loving it, and I know a lot of the women are like, but growth hormone's for men. I don't want to be muscly. I don't want to look like a man. You're not going to look like a man. It is not going to make you muscly. I'm not injecting you with massive amounts of growth hormone. It's simply a gel, transdermal application. You rub it on. I'll go through that in a separate video. I will monitor you. We're going to have conversations. We're going to go through loading and dosing schedule and amounts and how to titrate it up or down as needed. I'm going to hold your hand through this. It is easy to use. It is effective. And as far as anti-aging and weight loss go, you're gonna notice some benefits there as well. Ladies, it's preventative of osteoporosis. Growth hormone is preventative of so many different things. This gel is meant to trigger your pituitary to release more growth hormone. So you're telling your body to do its job rather than injecting growth hormone into yourself and having your pituitary shrink and do less and less and then become dependent on that. This you won't become dependent on. It's not going to affect the size of your pituitary. It's not going to shrink it. It's going to just prompt it like a nice little massage to do its job and to do it better. Thicker hair, skin tightening, cardiovascular health. Your lipid panels are going to change. You're going to adapt better. Your fat body ratio is going to improve. These are big things, guys. You can Google benefits of growth hormone, and if this cream is going to help your body produce more, in theory, that means you're going to get all of that benefit. It's going to be different for everyone, but from what we're seeing, it's all been very positive. You're also going to get that HPA access support, that hypothalamus, pituitary, adrenal access support. You're going to get adrenal support. I don't know about you, but COVID hit and all of us got stressed out. So whoever you are out there that says you're not stressed, I don't know what you're taking, but if it's wine, that's a coping mechanism, not a distressor. Let's put this cream to good use. Let's reduce our stress. Let's support our systems. Let's support our adrenals. Let's bring everything back to optimization and health. Our bones, our muscles, our tissues, they all need growth hormone. You're gonna have better moods. Your brain, it's gonna fire quicker. You're gonna be more responsive, which is fantastic. Did I mention improved moods? I don't know about you, but there's a lot of people out there that could use that right about now. I wanna run around the mall and go rub it on people because there's a lot of nastiness happening in the world today. Okay, so what about those of you that are injured? This stuff is reparative, so better fracture repair. I've seen patients, not my patient, but patients of colleagues, who have used this after a bone fracture. They have applied it to the site for wound healing, not an open wound, I'm going to clarify that, but a broken ankle, sprained ankle, fractured ankle, wrist, you name it. And it has actually sped up the healing process exponentially. There's something to be said for that. Growth hormone is the fountain of youth. It's going to sew you back together. I'm 42. This stuff is made for those of us in our 30s plus, because that's when our hormones start that rapid decline. Our hormones are our vitality. So why would we not want those to be healthy? I don't know about you, but I'm on board with this gel. You know what? If it doesn't do anything to regulate my hormones, but it does help my thyroid, it was worth it. If it doesn't, maybe you don't have a thyroid issue. Maybe you don't think you have a hormone issue, but it does help your sleep and your anxiety and reduce your stress, and you're finding that my neck is not as sore, my shoulder's not as sore, your aches and pains go away, then it's worth it. I'm hoping to see benefits with my neck pain because this position, constantly being on a computer, doing charting with patients, years in surgery with my head down, assisting a physician during the operation, task of hair transplants, etc. and so forth, I did a lot of the head down. So my neck is an a-hole, and I need to do cupping and massage therapy and physiotherapy and chiropractic. Now, I'm not saying you're gonna quit those things. I think chiropractic is something that's a very healthy practice, body attunement, all of that. However, the hundreds and hundreds of dollars that you're spending on these therapies versus the amount you're gonna spend on this gel, maybe you can see your massage therapist a little bit less. Maybe you can see your chiropractor a little bit less. Maybe your chiropractor is gonna wanna take this cream, this gel. All I'm saying is that it's worth a try. So let's do this. Let's try it out. Let's monitor your results and see what you're getting and how it's doing. Let's do this together. I'm excited. Are you?